Hello, everyone. Thanks for joining us on the media briefing today. We have a really great program today, so we're going to go ahead and get started. A lot of you may have heard about the Salinas Valley Memorial Healthcare System's mobile health clinic. It has been it's done an amazing job bringing healthcare services to underserved and remote areas of our county. And in fact, they have an increasing number of clients, 500 in the last month alone, and 3,400 clients overall. They are doing amazing work, and we're really pleased to have two people with this program with us today. Dr. Orlando Rodriguez, he's the Salinas Valley Memorial Healthcare System Mobile Health Clinic Medical Director, and Olga Morales. She is one of two bilingual community health advocates who help coordinate patient care. Thank you both very much for joining us on the media briefing today to talk about this mobile clinic. It's really a great program. Tell us a little bit more about what it does and how it got started.
Maya, thank you very much for having us here today. We are very excited to share with the community and with your group our growing reach and services of the Salinas Valley Memorial Healthcare System Mobile Health Clinic. For me personally, being part of the Salinas Valley Mobile Health Clinic has been one of the most rewarding experiences for me professionally. And I want to share a few slides with you here, if I may, about
Please
our
do.
mobile health clinic. So I always like to start out with our mission statement. Next slide, please. I'll briefly read it here. The Salinas Valley Memorial Healthcare System Mobile Health Clinic is dedicated to improving the health of our community by increasing access to care for those living in medically underserved areas, providing preventative and primary care where it is needed. Next. This is a picture of our mobile clinic. And as you can see, it is a state-of-the-art mobile clinic. It has 2 exam rooms and a waiting area which can be used as a 3rd exam room. We have a laboratory in the unit, and we also have a refrigerator and a freezer which we use to store our vaccines. We also have the ability to, no, not yet. We also have the ability to see handicapped patients, and you can see that we have wheelchair access into the mobile clinic. We're very blessed to have received this unit, and it's thanks to the generosity of the community and our foundation. This unit was donated to us. The monies were donated by the Sally Hughes Church Foundation, as well as by the Service League from Salinas Valley Memorial and others. Our unit is usually staffed either by a nurse practitioner or a physician. We have a medical assistant on board, and we have 2 community health advocates, one of them which is Olga, and she'll talk a little bit about what her role is. But what the community health advocates do on this unit is just such an amazing part of the services that we provide. We also have a coordinator and a driver. So we do a lot of different things, and I just really briefly will scan through some of our services. From a primary care perspective, we treat diabetes, high blood pressure, other chronic illnesses. We do a lot of health screenings to try to diagnose and prevent illnesses. We have in-house lab testing. We do a lot of simple urgent care visits, including viral illnesses, abdominal pains, fevers, rashes, lacerations, urinary tract infections. We believe that health screening is a very important part of what we do, and we do a lot of sports physicals at the different high schools. Vaccines are very important for us, and we try to recognize folks that need vaccines and vaccinate them accordingly. In the era here of COVID and during our pandemic, we've been very involved with COVID. We perform tests on site, and we're also giving vaccinations. We identify patients that have chronic illnesses, and if they need to be referred to other facilities, other healthcare sites, we refer them to those sites, and our community health advocates make sure that they get there and that they maintain their appointments. We also have the ability to do virtual visits if that is what's best for the patient. The community health advocates, Olga is here. She'll talk about what her job is. So I'll leave this slide for you, Olga. You can share what it is that you do after I'm done. But basically, they establish a trusting relationship, and they have the ability to communicate with the patient. They spend a lot more time with the patient, and they assess the social and health needs of the individual and how we can connect our patients to resources in the community. Next slide. So these are ours, and you can see that we're out throughout Monterey County, and this was that where we are was determined by where we felt there was the biggest need. And you can see that on Mondays, we're in Alisal High School. On Tuesdays, we're in Walmart and Everett Alvarez. On Wednesdays, we're in South County, being in King City, and also in the Greenfield Family Resource Center. And on Thursdays, we're at the Martin MLK Family Resource Center. On Sundays, we're out at the soccer complex. These folks that we've partnered with are amazing partners, and we feel blessed to be part of them and to serve the needs of their respective part of their communities. As you can see, we've been in existence since January of 2020, and right after that, the COVID pandemic hit. So we had some adjustments and adapting that we had to do. You can see that in the last year, our numbers have gone up dramatically, and in the last month, we saw over 500 patients. So there's a definite need out there, and we feel very blessed to be able to help all these individuals that have the need. We have adapted to the needs of the community during the pandemic. So we are where people need us and when they need us. I'm going to turn it over to you, Olga.
Hi, good morning, everyone. My name is Olga. I'm a community and health advocate here at the mobile clinic. So me, along with my coworker Yesenia, so we are very lucky to be the first point of contact with our patients. Just like Dr. Rodriguez mentioned, we do have that duty to connect our patients with low income resources. So for example, if a patient does come here and they obviously don't have health insurance, and even for them, it's a little bit shocking to know that we're not going to charge for the service. And so they'll come, we'll tell them, you're not going to pay anything. We treat them. And before they leave, they'll even ask again, how much is it for the visit? So they're a little bit shocked that we have that help for them. And even after they are diagnosed with a chronic health condition, we do work with them after their visit to make sure that they get the care that they need. And all of this is at no cost for them. And if they do need a specialist, we do try to work with them to find a low income program, which assists them financially. So we treat them, and even after they leave, we are following up with them to make sure that they do get the care that they need. And not only the physical care, we do also focus on the social aspect of the patients. And we're very thankful for our foundation to allow us to do so. So even other than the physical care, we do support them with social care, such as food assistance. We recently got blood pressure monitors for our patients, and they're very thankful. It's a way for them to just follow up with the care that they do have. And a patient story that I do have, and it's a very common story, which is why I'm gonna talk to you guys about it. We did have a patient who came to the mobile clinic. He hadn't been seen for years due to the cost of healthcare. He did come and he was treated, and he was diagnosed with prediabetes. And he was scared because he didn't know what that meant. So it was my job to just talk to him, and I referred him to a diabetes prevention program where he was successfully enrolled, and he did follow up with our mobile clinic, and thank God his A1C was back to normal, and he was very thankful for the assistance. So it's cases like these that make me feel very fortunate to be part of this team that's doing something unique in our community. And it's very important. Healthcare is important for everyone. So we're just glad to be out there meeting the needs of our patients and adjusting to their schedule. with the pandemic, everything's just, we try to like meet their needs, whether it being like the location, the time, the vaccines. We started doing that, and that's going good for our patients. We've been getting a lot of good feedback. That we've been getting patients that they refer themselves to us, so that speaks a lot about our service. And we're just here, we're thankful to be part of this new project for our community.
Thank you very much, Olga, and thank you very much, Dr. Rodriguez, for sharing this information. Before I open it up to questions, is there anything else you'd like to tell us about the program? No? Okay. That is a presentation about the mobile clinic. This is the time that we've set aside. They have to, our clinic partners are going to have to go back to seeing patients. So if there are questions for Dr. Rodriguez or Olga, this would be the time to send them in. I am not seeing any in chat. Is there anyone who's participating who has a question they would like to ask? If not, thank you both very much for sharing about the clinic, and we really hope to have you back and to find out, hear more about your success stories, and we'll see those numbers climb about patients, people being served.
Thank you very much.
And Olga, we'll let you go hang that picture back up again.
Sorry about that. Thank you.
Thank you very much. Great information. So moving on, we're going to go to Dr. Moreno and questions that people may have about COVID-19 this week or other public health information. Dr. Moreno, I see your name. Have we got you?
Yes, good afternoon, ma'am.
Good afternoon. Shall we go ahead with questions, or is there any information you want to share?
I don't have an update today, so I'll go ahead and take questions.
Okay, thank you. So I'm going to start with the questions that we had submitted in advance, and then I'm going to move to the questions that are in chat. So first question, is there a plan in place to vaccinate younger children when the EUA comes through? Will there be clinics set up as have been done in the past?
So yeah, thanks, Mia. So I can speak about public health clinics, and if anyone has questions about clinics run by other vaccine providers, I recommend that they contact those vaccine providers. But for public health, we've been running vaccination clinics and events about 4 to 6 events per week. And so we plan to continue to run the clinics, and when additional groups of individuals are eligible for vaccination, whether that's a primary series or third shots or booster shots, we will be able to offer those vaccines to individuals who qualify for those additional shots. But as a reminder, there are other vaccine providers in Monterey County. There's pharmacies, there's clinics, there's pediatric providers who are also offering vaccine. And so I just encourage people, parents, in this case, questions about kids, when parents of kids who are newly eligible to use the My Turn app to schedule an appointment for their eligible children.
Thank you. Next question. Are there any other county plans or efforts that are specific to vaccinating children 11 and under? For example, are we thinking about any town halls for parents? Is there coordination with the school districts? Maybe talk about some of the things that the health department is doing to coordinate with others.
Sure. So what I encourage people to do, parents, to do when their kids are eligible for vaccines is to schedule an appointment. It could be with one of our public health clinics, or it could be with another vaccine provider, their pediatrician's office if they're offering vaccine, other primary care clinics, outpatient clinics, and one of the many pharmacies that are providing vaccines. What comes to mind in terms of what the county will be doing is, what we're currently doing is our communication staff have been working through much of this pandemic to get messages out through radio messaging and social media messaging on pertinent and information for the community to be aware of what opportunities are available to them. So what we'll continue to do is, as more individuals are newly eligible for vaccine, or certain groups are eligible for third doses and booster doses, we'll update the media messaging to target those eligible populations.
And I'm sure, and I think you also, you might have left out that we're coordinating with a school district. A lot of our messaging is going directly to the schools and going out to parents through the Office of Education and school districts as well.
Well, I'll leave that to you, Maya. You're the PIO, so you're more up to date on that than I am.
All right. Last question of our advanced questions. Is the trend for cases and hospitalizations and positivity rate still moving downwards, as was the case a couple of weeks ago?
So yeah, so we're looking at these rates every week, and this week, early this week, our rates were still decreasing. These are case rates, excuse me, Maya. Case rates are decreasing in the county. They're also decreasing in the region, and decreasing across California. I just want to emphasize that where we're looking at, Maya, are trends, really focusing on the trends, not day-to-day changes or day-to-day fluctuations. So we're looking at the trends, and the trends still show that the case rates are dropping, decreasing, and positivity rates are decreasing. As far as hospitalizations, those have overall have been going down now for a couple of weeks. And again, we're looking at trends. So but at this point, I would say, looking over the last week, I'd say the hospitalization are probably stable at this point to increasing, but overall, the trend has been a decrease in hospitalizations.
All right, thank you. Now we're going to move into the questions that are in chat. How closely did the Monterey County Health Department work with the rodeo to organize their event? And what topics of I'm going to break this up into two sections. What topics of concern came up in regards to this event from the health officer perspective?
I don't have an answer for that question, Maya, but I can take it back to our team and get a response to the reporter.
Okay. Next question. What are your concerns in relation to COVID-19 about, this is in the rodeo. What would be your concerns in relation to COVID-19 about activities at the popular bull crossing bar section of the rodeo? Do you expect an increase in cases following this large event? And how could activities outside the rodeo also play a role in that?
Well, just a couple of things, May. I would still recommend that organizers of events here in Monterey County follow the CDPH guidance, and individuals attending these events follow state and local guidance and recommendations. I'm not quite that familiar with the events at the rodeo, so again, I'll take that question back and try to formulate a response for the reporter.
All right, thank you. Next question. With 3 of 5 Monterey County supervisors, I'm going to paraphrase this a little bit. Well, I'm not. Essentially superseding your authority by voting for a countywide mask mandate with certain metrics being met. Are you concerned you're losing confidence from the supervisors?
I would just say that the supervisors, as an elected body, took action that under the authority that they have to require masks for people indoors, which is stronger than my recommendation, and that's their legislative authority.
Thank you. Next question. What concerns do you have regarding the ongoing COVID outbreak at the Monterey County Jail, and what role is the health department playing in assisting with this situation?
Yeah, sure. So that is, we have an increase the jail has an increase in cases. And throughout this pandemic, there's been increases in cases in a variety of facilities, skilled nursing facilities, for example, just to mention one, but a variety of facilities. And so this is another situation where there's an increase in cases. So in this situation, as in other situations, when we're aware of the increase in cases, we make ourselves available to assist the organization and its leadership to do what they can to decrease the number of cases that are occurring, primarily through decreasing introduction of additional COVID cases into the facility and trying to reduce transmission of cases within the facility. So we review state and local guidance for identifying people who might have COVID. That would be through what's called screening testing. So the amount of testing in a facility like that would be recommended. We recommend that the testing be increased in frequency, including people who could be also certain people who are asymptomatic because they may have contracted COVID and may be spreading it within the facility. So increased testing, and our public health laboratory also is available to actually perform the testing of specimens that are collected at the jail. And we also review and emphasize sanitation protocols and also infection control protocols like distancing, like face coverings, and also really important, washing hands. We also, again, encourage individuals in the facility, working in the facility or residing in a facility like this to take advantage of the COVID vaccine. And also we also have been facilitating linking the facility with available treatment for COVID, which includes monoclonal antibodies. So letting them know who to contact and who might be eligible with COVID-19 to be treated with monoclonal antibodies to reduce the severity of the illness and the duration of the illness. And we also will work with them to identify people who meet the criteria for close contact and assist in making sure that they are following the state guidance for isolation for cases and quarantine for people who are close contacts, to make sure that they remain in isolation and or quarantine, and only the isolation and quarantine once they've met the state guidance. So those are some of the many things that we do in public health to assist organizations like the jail or other organizations who have increase in cases or outbreaks.
Thank you, Dr. Moreno. And then our next question, it appears to be the last question. With COVID trends leveling off or decreasing, how did Monterey County's transmission rate go from low to high in less than a week?
A very good question. So the CDC is getting information about Monterey County and running the data through an analysis and then posting case rate and positivity rate. And based on the case rate and positivity rate, the CDC categorizes each county, including Monterey County, into one of four groups. And so what we don't know is we don't know how they're or what formulas they're using to calculate the case rate. And so we can't explain why it jumped from, I think it was the blue zone or blue category into the red category in a very short period of time. It doesn't match the data that we're seeing here locally, which shows declining rates and declining positivity rates. So again, I don't know how they're calculating it.
Right. Thank you, Dr. Moreno. And then let me just ask you this, because and I think I know the answer, but I think it would be good for you to share. If people are interested in knowing our local rates, there are many places they can look for information. Where would you recommend people source information about Monterey County COVID related data?
Okay. What I'll do is I'll check with the team and get back to you.
Right. Thank you. That is all the questions that I have in chat. And if there are no other questions, we're going to let Dr. Moreno off the call. Wait, hold on. Got one more in. And this looks like a follow-up question to our last question about transmission. If we don't know how transmission rates went up, is that a concern? Because if we remain high, the county's mask mandate could go into effect.
Yeah, so that's the county's proposed ordinance, which will be voted on next week, does tie the implementation of their face mandate order to or ordinance to the CDC's community transmission category, so that they are tied. And again, I don't know how they're being calculated, but they are tied to the ordinance. It will be tied to the CDC's community transmission categories.
Okay, another question for you. Where do we stand with county, this may not be for Dr. Moreno. This is a question about the deadline for employees and employee vaccination. I'll have to get the answer of that updated data and get the answer back to the reporter who asked. Any other questions for Dr. Moreno? Seeing none, thank you very much, Dr. Moreno, for joining us on the call. We'll see you next week.
All right, take care, man.
And then we're going to wrap up our briefing with some good news. Monterey County is going to be submitting a grant application to create a new BMX pump track skate park project on county property in Salinas. This grant application is really the culmination of a lot of work that went into finding a project that could do well in a competitive grant situation. And Brian Flores, the interim parks director or interim parks chief, I don't know what to call you anymore, Brian, but you're the interim guy in charge. And hopefully, can you tell us more about the process that led up to this application and what is next?
Sure. Thanks, Maya. Hello, everyone. Brian Flores, interim chief of parks, man of many hats these days. But basically, yeah, it's been about a 6-month process leading up to this. And we actually, in addition to the board approving the application to move forward for the skate park, we also had a number of applications that we presented to the Board of Supervisors following direction from the Parks Commission. And so we have a number of projects. We have 2 projects at Lake San Antonio, which is a new amphitheater at North Shore, and a new marina at South Shore, in addition to the skate park. We did present them with 2 other projects for Fort Ord and for Toro Park that both had a suite of projects that, such as a youth camping area, mountain biking skills course, multi-use trails, things like that. But given the expense for CEQA for those 2 projects and the annual maintenance costs, the board determined that it'd be in the public's best interest to have us apply for the Lake San Antonio and the skate park at 855 East Laurel Drive, which is by the new sheriff building out by the courtyard there on Laurel. So it was about a 6-month process. We held a number of community meetings for all the different projects as one of the, well, it wasn't a requirement, it would help us be more competitive in the grants. And this is through the Prop 68 grant funding through the state. And it is a competitive grant process. We will be putting in a number of applications. And we held at the minimum 2 community meetings, one during the week in the evening, and then one on a Saturday midday. And all of them were very well attended and some really great comments from the public. And then we brought that to the Parks Commission for their input, and the Parks Commission recommended to the Board of Supervisors for the 2 lakes projects, the skate park and then Toro and Fort Ord. And like I stated, the board determined that it would be in the best interest to forego the Fort Ord and Toro Park projects right now. However, they also made a promise to come back with a parks master plan for those 2 areas, for Toro and the Fort Ord travel camp properties, which has been needed for a long time to help guide us into the future with the types of improvements and maintenance activities that we need to do there. So there's a couple different grant programs, one being the statewide park program, which we submitted for San Lorenzo Park. A few months back, we were waiting to hear from the state on whether or not that was successful, and we'll be awarded for that. And some of the project components include a water-themed splash pad park, an outdoor education area for the Monterey County Rural Ag Life Museum, and some additional barbecue areas and some park improvements that are parking lots and walkways, things like that. And then we have the Rural Recreation and Tourism Grant, which would be for the Lake San Antonio North Shore Amphitheater and for the South Shore Marina. And then we have the, what is it called here? The Regional Park Program, which would be for the East Laurel Skate Park and BMX course. So it's something that the county has been wanting to do for a number of years, and it got a lot of positive feedback from the community and from Supervisor Alejo. Thank you very much for him really pushing the public to get in front of us and voice their opinions on this. So it was a really great process to be involved with. And in addition to those, we also, the board approved us moving forward with, while it's not a competitive grant, applying for the per capita funds that the state has, which are based on the county size and things like that. And we're due to receive $631,430, of which we will also add in $157,000 as a matching fund for different types of facility maintenance projects, such as new roofs, new water systems, upgrades to existing sanitation systems and electrical systems for campgrounds, things like that. So it was a very exciting day for Monterey County Parks and for the public at large to have the board support these projects and to move forward with the application process. Applications are due November 5th. And we'll be taking on the CEQA and the design elements once we apply and get those turned in within a couple of months after the application, and hopefully we're successful on at least one of these applications. So.
Brian, I'm wondering if you can talk about the importance of the grants for these projects, because these are not small dollar value projects. If you could share a little bit about the cost of these, and which is why getting a grant for them is so critical.
Sure. So both the amphitheater and the marina and the skate park, the grant maximum is $3 million. And so we are going to apply for the full amount for those projects. And so if we get it, yeah, it's a big chunk of money, and we can create some really nice amenities for park users with the hopes to, especially with the amphitheater, increasing county revenues outside of lake operations. So in low water years, things like that, we take a big hit to our budget. And so we're hoping to have some non-water dependent activities and amenities for the public to enjoy.
And that's $3 million per project, not overall, correct?
Correct. $3 million for the amphitheater, $3 million for the marina, $3 million for the skate park. Okay. And the SPP, the Statewide Park Program grant that we already applied for San Lorenzo Park, that was an $8 million project. And should that get kicked back or not approved by the state, then we will move forward with trimming that project down to meet the $3 million cap and applying for that under the Rural Recreation and Tourism Grant as well.
All right. Thanks very much. Are there any questions for Brian about this upcoming application or any of the projects that we hope will be moving forward? If not, we've got some information about the application. We'll be sending that out later today. And if there's no other questions, that will wrap up the briefing for today. Thanks everyone for joining us. Our next briefing is next week. We'll see you then.
Thank you.